Major physiological ions. There are 7 major physiological ions, namely the calcium, sodium, potassium, chloride, phosphate, bicarbonate, and the magnesium. We all know that calcium is very important in our body, most especially for our bones, because 99% of the body calcium is found in the bones, and the remaining is present in extracellular fluid compartment, and only 10% of the ingested calcium is absorbed from the intestinal tract, and the remainder is excreted with feces. The concentration of calcium in plasma averages about 9.4 mg per deciliter, or 9 to 10 mg deciliter. Calcium level in plasma is regulated within narrow limits by parathyroid hormone. Calcium in plasma is present in 3 forms. First, about 40% is combined with plasma proteins and is non-diffusible through the capillary membrane. Second, 10% is combined with other substances of plasma and interstitial fluid such as the citrate, phosphate, and is diffusible through the capillary membrane in such a manner that it is not ionized. Third, the remaining 50% calcium present in plasma is diffusible through the capillary membrane and ionized. This ionic calcium does most of the functions of calcium in the body. Calcium is important for blood clotting, contraction of various smooth muscles, and cardiovascular system. Calcium is essential for contraction coupling in cardiac muscles as well as for the conduction of electric impulse in certain regions of the heart. It also plays an important role in maintaining the integrity of the mucosal membrane, cell adhesion, and function of the individual cell membrane as well, metabolic acidosis, and for the kidney damage. Change in blood pH can influence the degree of calcium binding to plasma proteins. With acidosis, less calcium is bound to plasma proteins and cause hypocalcemia. Hypocalcemia can cause when the nervous system is depressed, and the reflex action of the central nervous system can become sluggish and can decrease the beating interval of the heart, which can lead to cardiac arrhythmia. It causes constipation and lack of appetite, and depresses contractility of the muscles of the wall of the GIT. When calcium ion concentration falls below normal, the excitability of the nerve and muscle cells increases markedly. Next is the sodium. Sodium and its associated anions, mainly chloride, account for more than 90% of the solute in the extracellular fluid compartment. The concentration of sodium is 142 milliequivalents per liter in extracellular fluid and 10 milliequivalents per liter in intracellular fluid. Plasma sodium is a reasonable indicator of plasma osmolarity under many conditions. The deficiency state of the sodium is the hyponatremia that can result from loss of sodium chloride from the extracellular fluid. Conditions that cause hyponatremia owing to loss of sodium chloride include excessive sweating, diarrhea and vomiting, overuse of diuretics that inhibit the kidney to conserve sodium, and the Addison's disease, which results from decreased secretion of hormone aldosterone. Hypernatremia can be due to excessive water loss from extracellular fluid, as in ADH deficiency in the secretion of sodium, which is the retaining hormone aldosterone, or Cushing syndrome, excessive treatment with sodium salts. Conditions causing hypernatremia or the increased serum sodium level are hyperadrenalism or the Cushing syndrome, which increases aldosterone production, severe dehydration, certain types of brain injury, excess treatment with sodium salts. There is a good correlation between sodium content of the tissues, as in the sodium chloride, and hypertension. If sodium concentrations increase in the body and is not eliminated, then water is retained in the tissues to maintain osmotic balance, so edema occurs and the buildup of fluids puts an added burden on heart. And the treatment of this is low salt diets, diuretics, and the cardiotonic drugs. Potassium is the seventh most abundant element in Earth's crust. It is a major intracellular cation present in a concentration approximately 23 times higher than the concentration of potassium present in extracellular fluid compartments. About 95% in the cells and only 2% in extracellular fluid. Extracellular fluid potassium concentration is normally precisely regulated at 4.2 milliequivalent per liter. This is because many of the cell functions are sensitive to change in the extracellular fluid potassium concentration. Maintenance of potassium balance depends primarily on its excretion by kidney because only 5 to 10% is excreted in feces. Both elevated and low levels of potassium can be fatal. During the transmission of a nerve impulse, potassium leaves the cell and sodium enters the cell. The deficiency state of high potassium is the hyperkalemia. It occurs due to high intake of potassium or in kidney damage. Increase in potassium concentration can cause cardiac arrhythmias and lead to cardiac arrest by fibrillation. Next is the chloride. Chloride is a major extracellular anion. It's principally responsible for maintaining proper hydration, osmotic pressure, and normally cation and ion balance in vascular and interstitial compartments. The concentration of chloride is 103 milliequivalent per liter in extracellular fluid and 4 milliequivalent per liter in intracellular fluid. Chloride ion has no pharmacological activity. It is used as a urinary acidifier. Decreased chloride concentration can be the result of salt-losing nephritis, leading to lack of tubular reabsorption of chloride, metabolic acidosis such as found in diabetes mellitus, and renal failure, and the prolonged of vomiting. Increased concentration of chloride may be due to dehydration, decreased renal blood flow found with congestive heart failure, and the excessive chloride uptake. Phosphate. The principal anion of intracellular fluid compartment. It is inorganic phosphate in the plasma is mainly in two forms, HPO4 and H2PO4, which is the concentration of HPO4 is 1.5 millimole per liter and concentration of H2PO4 0.26 mole per liter. The total quantity of the phosphate in extracellular fluid rises, so does the concentration of each of these ions. When pH of the extracellular fluid becomes more acidic, there is relative increase in H2PO4 and decrease in HPO4 and vice versa. Phosphorus is essential for proper metabolism of calcium, normal bone and tooth development. HPO4 and H2PO4 makes an important buffer system of the body. Hyperphosphatemia can be found in hypervitaminosis D, renal failure, and then hypoparathyroidism. Hypophosphatemia can be due to vitamin D deficiency, hyperparathyroidism, and possible long-term aluminum hydroxide antacid therapy. Bicarbonate. Bicarbonate is the second most prevalent anion in extracellular fluid compartment. It is along with carbonic acid that acts as body's most important buffer system. When there is reduction in the extracellular fluid hydrogen and ion concentration, all the alkalosis. The kidneys fail to reabsorb all the filtered bicarbonate, thereby increasing the excretion of bicarbonate because bicarbonate ions normally buffer hydrogen in the extracellular fluid. The loss of bicarbonate is as good as adding a hydrogen ion to the extracellular fluid. In alkalosis, the removal of bicarbonate ions raises the extracellular fluid hydrogen ion concentration back towards normal. In acidosis, the kidneys do not excrete the bicarbonate in the urine but reabsorb all the filtered bicarbonate and produces new bicarbonate which is added back to the extracellular fluid. This reduces the extracellular fluid hydrogen ion concentration back towards normal. The importance of bicarbonate. Sodium bicarbonate may be considered from the standpoint of two relationships. Its relationship to the body as a buffer components, therapeutic, and miscellaneous uses. The normal acid-base balance of the plasma is maintained by three mechanisms: the buffers of the body fluids and red blood cells, pulmonary excretion of excess carbon dioxide, and the renal excretion of either excess acid or base. Sodium bicarbonate is used in medicine principally for its acid neutralizing properties. It is used to combat gastric hyperacidity and to combat systemic acidosis for miscellaneous uses. Oral administration of the drug causes a lessening of the acidity of the urine, and effects has been used during the administration of certain drugs such as sulfanilamide and its related drugs to increase the effectiveness or lessen the possibility of drug crystallizing in the kidneys or urinary tract. The last one is the magnesium. Magnesium is the second most plentiful cation in the intracellular fluid. About 50% of total body magnesium is combined with calcium and phosphates in bones. Essential component of many enzymes involving phosphate metabolism. Also used in functioning of neuromuscular system. Magnesium has definite pharmacologic action. Its salts, when injected, have powerful general anesthetic action. Soluble magnesium sulfate used for CNS depressant in obstetrics, convulsion states, symptoms of tetanus due to slow absorption of magnesium orally, so used as a saline cathartic and a laxative. Causes of negative magnesium level are malnutrition, dietary restrictions, chronic alcoholism, faulty absorption, gastrointestinal diseases, medications, and parathyroid hormone imbalances.
Now, let us proceed on the fluids, electrolytes, and nutrition in their physiological and clinical aspects. Here are some importance of fluids and electrolytes in our body. First, fluids help to prevent dehydration in the body because dehydration can cause headaches, fatigue, confusion, and irritability. Next, it helps your kidneys work to produce urine and remove waste from the body. Lastly, it helps you protect and cushion joints and organs. While electrolytes regulate nerve and muscle function, hydrate the body, balance blood acidity and pressure, and help rebuild damaged tissue. Maybe you will ask, why do we need electrolytes if there is already water that could hydrate us? The answer is because the ions that were mentioned earlier are responsible for directing water to those areas in your body that need it most. Here are the common forms of fluids and electrolytes. First, it can be a drink. Second, it can be in a tablet form. Third, it could be a powder form. And lastly, it could be in an intravenous drip. In drinks, it is usually in the form of sports drink, and it is used to quickly replace fluids, carbohydrates, and electrolytes that you lost during extreme activity. The example in this picture is an effervescent tablets, which means that it should be put in water first and wait for it to dissolve completely before you take it. The powdered form of electrolytes is mixed with water, and it usually comes with different flavors that taste like juice. Electrolytes in IV drip form is usually used when we are admitted to the hospital. It is used to restore the fluid and electrolyte balance of the body due to the illness, surgery, or accident. We can also get electrolytes from the food that we eat, and here are some of the examples. Nuts, which contains magnesium as well as significant amounts of calcium and potassium. Potatoes, which contains potassium. Broccoli, which contains magnesium and potassium. Sunflower and pumpkin seeds, which is packed with magnesium and phosphorus. Cow's milk, as we all know that it is a great source of calcium. And table salt, which is of course rich in sodium.
Hello everyone, so one of our topic is fluid and electrolyte imbalance. So fluid and electrolyte imbalance is a dynamic process that is crucial for life. It plays an important role in homeostasis. It is also the result from many factors and is associated with illness. Water is a major importance to all living things. In some organisms, up to 90% of their body weight comes from water, and up to 60% of the human adult body is water. Composition of body fluids. So the total body fluids of a human body is 60% of body weight, and it is divided into two fluid compartments. The first one is the intracellular fluid, which is the system that includes all fluid enclosed in cells by their plasma membranes. And the other fluid compartment is the extracellular fluid. It surrounds all cells in the body. And extracellular fluid has two primary constituents. The transcellular fluid, which is the fluid component of the blood that is called plasma, and the interstitial fluid that surrounds all cells not in the blood. And it is 15% of the body weight. So first, let us discuss what is electrolytes. So electrolytes are substances that disassociate in solution and have the ability to conduct an electric current. Electrolytes is also the elements and compounds that occur naturally in the body. They control important physiologic functions. The electrolyte is divided into two: the cations, which is the positive charges, and the anions, which is the negative charges. The cations are the sodium, potassium, magnesium, and hydrogen ions, and the anions are the chloride, bicarbonate, phosphate, and sulfate. These substances are located in the extracellular and intracellular fluid. Within the extracellular fluid, the major cation is sodium, and the major anion is chloride. And the major cation in the intracellular fluid is the potassium. Osmosis. Osmosis is the fluid shifts through the membrane from the region of low solute concentration to the region of high solute concentration until the solution are of equal concentration. So, osmosis is the tendency of a fluid, usually a water, to pass through a semi-permeable membrane into a solution where the solvent concentration is lower and the solute concentration is higher. Diffusion. Diffusion is a substance to move from an area of higher concentration to one of the lower concentration. So the overall effect is to equalize concentration throughout the medium. Fluid volume disturbances. Hypovolemia. It is the fluid volume deficit. It is the decrease in the volume of blood in your body, which can be due to blood loss or loss of body fluids. Hypervolemia. It is the fluid volume excess. It is the condition when you have too much fluid in your body. It is also described as having excess water retention or fluid overload. The main electrolyte imbalance. Sodium deficit, or also called the hyponatremia. And when you have sodium excess, it is called hypernatremia. Potassium deficit, it is called hypokalemia. And potassium excess, or too much potassium in the body, it is called hyperkalemia. calcium deficit is hypocalcemia, and calcium excess is the hypercalcemia. Before we start, let us know first the difference between the hyper and the hypo. Elevated levels of an electrolyte are indicated with the prefix hyper, and depleted levels of an electrolyte are indicated with the prefix hypo. Hyponatremia. Hyponatremia, it results from loss of sodium containing fluids or hypoosmolality with a shift of water into the cells. It develops when there is too little sodium in your body. The common causes of low sodium levels includes diarrhea, vomiting, nasogastric suction in gastrointestinal loss, in renal loss, diuretics, adrenal insufficiency, and wasting renal diseases, and in skin loss, excessive fluid loss through the skin from sweating or burns, and wound drainage. So for the medical management, first, sodium replacement administration of sodium by mouth who eat and drink. The second one is the lactated ringer solution, or the 0.9% sodium chloride is prescribed. Ito yung mga dextrose. And the third one is the serum sodium must not increase greater than 12 ml equivalents per liter in 24 hours to avoid neurological damages. Hypernatremia. Hypernatremia is a higher than normal sodium level exceeding 145 ml equivalents per liter. It occurs when there is too much sodium in the blood. So, abnormally high levels of sodium may be caused by gain of sodium in excess of water, inadequate water intake, and increased serum sodium concentration. For the medical management for this disorder is first, gradual lowering of the sodium level by the infusion of hypotonic electrolyte solution, 0.3% sodium chloride, and diuretics also may be prescribed to thwart the sodium gain. So, the next one is the potassium imbalance. So, potassium is a major ICF cation, or the major intracellular fluid cation, with 98% of the body of intracellular compartment. Potassium is critical for many cellular and metabolic function. The kidneys are the primary route for potassium loss. 90% of daily potassium intake is eliminated by kidney. So, potassium is particularly important for regulating the heart function, and it also helps to maintain healthy nerves and muscles. Hyperkalemia. Hyperkalemia may be caused by a massive intake of potassium. Ito yung kapag nasobrahan ka na ng pag-intake ng potassium. So, this condition can be fatal because it left undiagnosed and untreated. It is typically triggered by excess or rapid parenteral administration, potassium-containing drugs, acidosis, crash injury, tissue catabolism or fever, and renal disease, adrenal insufficiency, and ACE inhibitors. For the medical management for this, the immediate electrocardiogram should be obtained, and serum potassium level from vein without IV fluid infusion, restriction of dietary potassium, potassium-containing diuretic, and IV calcium gluconate administration and serum potassium level are dangerously elevated. Hypokalemia can result from abnormal losses of potassium from a shift of potassium from ECF to ICF, or the extracellular fluid to intracellular fluid, or rarely from deficient dietary potassium intake. And this often happens as a result of potassium loss, shifts of potassium into cells, lack of potassium intake, and the medical management for this is that it is treated with oral or IV replacement. Administer 40 to 80 ml equivalents per day of potassium. Medical management for this is that it is treated with oral or IV replacement. So, you need to administer 40 to 80 ml equivalents per day of potassium. So, syempre, kulang ng potassium yung fluid, ay yung blood. So, the first thing to do talaga is to intake potassium para ma-replace yung mga nawalang potassium. And the next one is, when oral administration of potassium is not feasible, the IV route is indicated. For a patient at risk for hypokalemia diet, containing potassium should be provided. The next one is the calcium imbalances. More than 99% of body's calcium is located in skeletal system, and it is a major component of bone and teeth. About 1% of skeletal calcium is exchanged with blood calcium. So, calcium is one of the component para mag-form ng bone and teeth. So, calcium plays a major role in transmitting nerve impulses and helps to regulate muscle contraction and relaxation, including cardiac muscle. Calcium is also a vital mineral that our body uses to stabilize our blood pressure and nagakontrol din ng skeletal muscle contraction. Hypocalcemia, a condition that causes a decrease in the production of PTH, may result in the development of hypocalcemia. PTH is the parathyroid hormone, or also called the parathormone or parathyrin, and it is a hormone secreted by the parathyroid glands that regulates the serum calcium. So, hypocalcemia may be caused by multiple blood transfusion, chronic renal failure, elevated phosphorus, chronic alcoholism, and alkalosis. So, the medical management for hypocalcemia is that IV administration of calcium like calcium gluconate, calcium chloride, and calcium glucosidase. Vitamin D therapy may be initiated to increase calcium absorption from gastrointestinal tract and increasing the dietary intake of calcium at least 1,000 to 1,500 mg per day. So, yun nga, kapag kulang, syempre kapag kulang, kailangan i-replace. Kaya yun, i-replace ng calcium. So, kapag sobra naman, kailangan naman bawasan. Ganun lang. Hypercalcemia. Hypercalcemia is the excess of calcium in the plasma and is dangerous imbalance when severe. A crisis has mortality rate as high as 50% if not treated properly. Hypercalcemia is really very dangerous kasi most of the causes nito is severe. Hypercalcemia is really dangerous kasi yung mga causes nito is critical na rin. Like for example, the multiple myeloma, or it is the cancer, a cancer that forms in a type of white blood cells. The next one is the prolonged immobilization, or the resulting from acute spinal cord injury that is stimulated by osteoclastic bone resorption. This process causes calcium loss from the bones and hypercalciuria. So, hypercalcemia results when the efflux of calcium is massive or when the glomerular filtration rate of the kidneys is reduced. And the third one is the vitamin D overdose, or the vitamin D toxicity. It is buildup of calcium in your blood, which can cause nausea and vomiting, weakness, and frequent urination. This vitamin D toxicity might progress to bone pain and kidney problems such as the formation of calcium stones. And the last one is thiazide diuretics. So, by increasing calcium reabsorption from the luminal membrane into the interstitium in exchange for sodium. And for the medical management for hypercalcemia is to first administer fluids to dilute serum calcium and promote its excretion by the kidney. The next one is the IV administration of 0.9% sodium chloride solution temporarily dilutes the serum calcium level. So, the IV administration na yung 0.9% of sodium chloride solution is temporarily na bababaan niya yung level ng calcium in the blood. And the next one is that administering furosemide increases calcium excretion. The next one is the calcitonin is administered to lower the serum calcium level. To sum it up, an electrolyte disorder occurs when the levels of electrolytes in your body are either too high or too low. Electrolytes need to be maintained in an even balance for your body to function properly, otherwise, vital body system can be affected. Because severe electrolyte imbalances can cause serious problems such as coma, seizures, and cardiac arrest.